Hello, I'm Dr. Clifton Huang, and I am the Director of the Advanced Endoscopy and Pancreaticobiliary Program here at Cook Children's. I am honored to be a recipient of the Cook Children's Health Foundation Endowed Chair in Confocal Laser Endomicroscopy. I am an advanced endoscopist in the field of pediatric gastroenterology, and to my knowledge, one of the 2 pediatric gastroenterologists in the U.S. trained to perform the Confocal Laser Endomicroscopy, or CLE. CLE is an emerging endoscopic technology developed to obtain high magnification and resolution images known as optical biopsies of the gastrointestinal mucosa at the cellular and subcellular level. This modality enables in vivo histological assessment during an endoscopy to allow for pathological evaluation in real time. This technology is studied more extensively in Europe among adults, but not in children. The Endowed Chair enables me to use this novel technology to develop live diagnostic criteria using CLE, validated with conventional histology for multiple gastrointestinal conditions, including eosinophilic esophagitis, gastritis, assessing non-IG mediated food allergies, and inflammatory bowel disease, or IBD. The latter two will be the primary focus for the initial phase of the Endowed Chair. I believe this research will contribute to national data for outcomes and improvement of remission rates, as well as serve as a roadmap to a personalized treatment in the management of IBD in children. Although biologics, which are monoclonal antibodies, have revolutionized the treatment of IBD, there are only a few that can be used in children. They are extensive and they produce side effects which can be debilitating, and studies have shown that the risk of losing response to treatment is high, which means in a year this can be up to 40% of children. A potential solution to this is to administer monoclonal antibody therapies tailored to the individual's drug susceptibility. This is where CLE comes in, which will enable me to demonstrate the membrane tissue binding capacity in the biopsied tissue and thereby treatment response. By doing this, I can avoid using a biologic on a patient if it showed poor tissue response. But this would not be possible to pursue without the support I received from the Endowed Chair, and I truly believe that it paves the pathway to obtaining the resources and collaborations making Cook Children's healthcare system a center of excellence in the management of IBD and non-IG mediated food allergies and food intolerances. One of the first things we need to determine is if endoscopic findings using CLE is concordant to histology. This has been shown in adults, but limited literature exists in the pediatric population. We're able to demonstrate that the endomicroscopic findings were comparable to histology. The next step would be to test the biopsy diseased tissue in IBD, as well as a few controls who would be patients without IBD, and assess the tissue response using CLE. This will ultimately lead to the development of predictive assays to determine patient response to current antibody therapies, thus providing personalized treatment to each patient. Similarly, in food intolerances and non-IG food allergy testing, we have been able to demonstrate a specific live test result using CLE, where we can directly assess reactions to allergens that previously tested negative with routine IgE blood tests. The Endowed Chair has provided the collaborations to develop a multidisciplinary team for undertaking this novel research project, which requires basic science, laboratory expertise to perform the ex vivo staining protocol, spatial proteomics, and transcriptomics testing. The Endowed Chair also provides a tremendous opportunity to collaborate and develop algorithms using artificial intelligence to predict responders versus non-responders, and to further subclassify IBD patients using phenotypic data. This is groundbreaking research for how we think about treating pediatric patients with IBD who have to live their life coping with the disease. The least we can do is help them to become healthy adults and live life to the fullest by providing them the right medication that would be specific for them, which is what we hope to achieve through this Endowed Chair. I have presented our data at multiple national and international meetings, most notably the Digestive Disease Week conference, which is the largest platform in the world for adult and pediatric research and advancement in clinical practice. I have also trained adult and pediatric gastroenterologists in performing food allergy sensitivity testing using CLE.